I had an abortion when I was 15 years old in my home state of Arizona in 1994. It was not a decision that I made lightly, but I have never for one moment doubted that it was the right decision for me. But so much has changed in Arizona and many other states since then. If I were that same 15-year-old in Arizona today legally, I would have to get parental consent. I would be forced to undergo a medically unnecessary ultrasound, go to a state-mandated in-person counseling session designed solely to shame me into changing my mind, and then take a state-mandated 24-hour time out to make sure I really know what I wanted. And finally, I would be forced to give the state a reason why. Well, here is mine. It is my body, not the state's. Women and their doctors are the ones that are in the best position to make informed decisions about what is best for them, no one else.
I've been litigating abortion cases for more than 2 decades, and I'm here to tell you that today we're facing a crisis. Here's the thing. The court doesn't have to overturn Roe v. Wade in order for states to push abortion entirely out of reach. For many today in our country, abortion is already more theoretical than real. This is particularly true for people with low incomes, people of color, immigrants, young people, and LGBTQ people. That's why Congress must pass the Women's Health Protection Act. That bill would safeguard against not only outright bans, but also clinic shutdown laws and other restrictions that prevent people from getting care. As the mother of 2 fabulous children, I know that the decision about whether to become a parent is one of the most important ones we make in our lives. It's the job of our government to ensure that we can actually make real decisions, whether that's to continue a pregnancy or to end it, in a way that is best for ourselves and our families.
One young lady told me of the nightmares that she had the night prior to coming into my clinic because she felt that she would be denied services because of these restrictive laws. In addition to legal obstacles, providers and patients face constant harassment. To enter the clinic or my obstetric practice, patients have to walk through a line of protesters who yell hateful, dehumanizing, sometimes racially charged things. Needless to say, this harassment is unheard of for my colleagues who work in other fields of medicine. The bottom line is this: abortion is health care. Alabamians deserve better. I urge elected officials to show empathy for the lived experiences of people who need health care, be it abortion, miscarriage management, or prenatal care, for they all are connected. Health care should remain patient-centered, and all medical decisions should remain between a patient and her physician without any political interference. Thank you.
Can you describe why these laws would still end up punishing women who seek abortions?
It can punish women in multiple ways. First, if there's no constitutional right to abortion, if the Supreme Court were to overturn Roe versus Wade, there would be nothing to stop states from going after women and punishing women. The fact that they're not saying that today doesn't mean that they won't say that tomorrow. Second, these laws do punish women by preventing them from getting the care that they need. In states like Georgia and Alabama, it's particularly galling. These states have some of the highest maternal mortality rates in the country. These are states that lack appropriate health care. They lack OBGYNs, they lack obstetrical departments, and Georgia is one of the states in this country who has refused to expand Medicaid coverage to ensure that people can get the health care that they need. So bans on abortion, forcing people to stay pregnant against their will, is a punishment, aside from the criminal punishment that could befall women if Roe is overturned.